Okay, so welcome everybody to today's webinar. I'm Allison Foster. I'm the Executive Secretary of Delta Mega, and I'll be hosting today's presentation. So Delta Mega is the Honorary Society for Public Health. There's over 100, I believe it's over 140 chapters now, and we've inducted over 30,000 members since Delta Mega was created 100 years ago. And since 2001, Delta Mega has been hosting an award for faculty at schools and programs with Delta Mega chapters, the annual Innovative Curricula Award. I can't believe it's been over 20 years, but the award's still going strong. The award is really designed to stimulate the development of curricula that prepares graduates in meeting the challenges of modern public health and encourages innovation. So today, I'm very pleased to present the winners, the winner of the award and one of the high-scoring nominees as part one of a two-part webinar series. So I'm going to very briefly share my screen. Here we go. Okay, all right. So today you're going to hear from Dr. Jennifer Schindler-Ruwisch from Fairfield University Public Health Program. She was the winner of the 2025 Innovative Curricular Award. Congratulations. And she'll be presenting on the course Public Health, Disease, and Injury. And you're also going to hear from Dr. Priscila de Silva Castanha from the University of Pittsburgh School of Public Health, and she will be presenting on infectious disease emergencies and public health perspectives. All right, so we've got a great couple of presentations to look forward to. We'll probably be here a little over 30 minutes. And while we are presenting, please go ahead and put your questions into the Q&A so we can take some questions at the end. So Dr. Schindler-Ruwisch, I'm going to go ahead and turn it over to you. Thank you very much.
Thank you so much, Allison, for that warm welcome. And I'm really honored and excited to be here to tell you a little bit about my course. Let me just pull up the slides for you here, and we'll get started. Great. Hopefully you can see those okay. So today I want to tell you a little bit about my class, Public Health, Disease, and Injury, which is a social justice-driven, community-engaged learning course. And thank you, Delta Omega, so much for this opportunity. So just a little bit about the class itself. This is a class taught to undergraduate students. It follows our Intro Public Health 101 course. It's a little bit of a deeper dive, and it did receive designations in social justice and community engaged learning, which is an intentional approach where we have to apply and have pedagogy and syllabi review and training to ensure we're incorporating these components into our courses. I try to keep the class on the small side if possible, so 20 students or less. We meet weekly and we have this didactic in-class learning portion, but we also spend about half the course either preparing for or going to our community engagement with Caroline House in our nearby neighborhood of Bridgeport. And so we do 3 monthly wellness workshops over the course of the semester, about 1 workshop a month. So I'll tell you a little bit more about those. But just in general, the course is meant to follow the intro course. We do a topical dive into a variety of health topics: maternal health, vaccination, cancer prevention, tobacco and alcohol use, opioid use, misuse, a variety of topics, but we do it through a social justice lens. And so we're examining health disparities and health inequities across these multiple health contexts. And the goal is for the students really to think about this work, not just as we learn about it in these health contexts, but how they can apply it to their community and their world, and to also center their own social identity and understand how that brings context to this conversation. So the goals of the course are to have students use concepts and principles to design communication materials for community audiences, and we'll talk about how we do that through our wellness workshops, and also to recognize inequity related to racial and societal injustice, and to then again understand their specific identity, their role, their privilege, and how that perpetuates and can be involved in the cycle of power, oppression, and inequality. So here are some of the course objectives. I'll just go through them quickly to understand some of the current contributors to inequitable burden of disease, both in our local community and more broadly. We try to really focus on a social ecological framework here. So going beyond the individual behavioral approach to expanding their knowledge to how is disease and injury occurring beyond the individual level. So really taking into account those contextual factors. Then they try to communicate public health messages with health literacy grounded in cultural humility, identify areas of bias and personal growth to prepare for ethically responsible community involvement, and then really to recognize the inherent value of the community experience and how we shape our health promotion efforts. I'm really grateful to use two wonderful texts and resources in the course. The first is Under the Skin by Linda Villarosa. If you haven't read it, I highly recommend it. It's a fantastic text. It has a journalistic perspective, so it reads really like student friendly in a narrative format, but it's just chock full of evidence and data and resources for us to untangle together in class. It has a lot of the health context that we cover: maternal health, opioid use, misuse, HIV/AIDS, so we can do it chapter by chapter. And then we also look at the student companion to community engaged learning, which our library actually offers a electronic version for free. And this book by Donahue and Plaxton Moore is a really nice complement to our community engagement piece. Our CEIF competency that's most relevant for this class, although we do cover a variety of different CEIF domains, are to communicate public health information orally and in written format through a variety of media to diverse audiences. And we really do that through our community engagement component, which I'm going to describe a little bit more here. So this is Caroline House. It's a local nonprofit in Bridgeport, Connecticut, with the mission to enable women and children to reach the fullness of their potential through education in English language and life skills. It's an absolutely beautiful place that serves the holistic well-being of the people who participate in their programming, from social services, child's care, education, resources. And so we were able to fortunately integrate a wellness component. We started that a few years ago. Back in 2019, we just started volunteering with a small group of students to deliver wellness-related topical information that the community curated and had interest in. And after doing this for several years, we decided that we might be able to be more responsive to the community needs if we did a more formal project. And so we utilized photo voice, which, if you're familiar with the qualitative methodology, you allow individuals to take pictures. And in this case, we wanted to have participants at Caroline House show us pictures of things that impacted their health and well-being, so the determinants of health in their community. And through this collaborative work, we hope to be better able to inform our wellness workshops. And so this methodology, I won't go into it in too much detail here, but it's wonderful because it's grounded in community-based participatory research. It transcends language differences, and it really helps foster collaboration, mutual respect, and conversation. This was an IRB-approved project, and of course, not everyone had to participate. It was totally optional. You could still be part of the program without participating in the project. But for those who were interested, we did consent in English and Spanish written, and we had a verbal interpreter as well. It was great because we collected really rich qualitative data and photos from the community that highlighted a lot of great insight. And then we were able to take those photos, and the students in my class put them on poster boards. We brought them to our wellness dialogues, and we had really strong conversations, robust conversations with community members about what were the determinants of health, how could we address them, how could we collectively talk about them. And so I give you just a brief description here of what the timeline looked like, and there's more details about the method in this paper that we co-published with our community partner. But there was a lot of IRB preparation and planning and data collection, but then we really reviewed the photo voice results over our three workshop series, so one semester, where we gathered reactions and we looked at themes and we talked about action-oriented follow-up. And then obviously there was some ongoing sustainability that we're still working on now. And so what really came out of this was a lot of narrative storytelling, which helped us to explore the public health context better and gave a voice to the photos. And so this is just a small sampling of the photos that were taken by community participants. But the theme that rose to the top, that seemed to be the most pressing issue that the community wanted to address, was environmental justice, issues of trash, hygiene, pollution, neighborhood cleanliness, littering, air pollution, even from smoking and marijuana use. And so these were the things that we decided that we were going to talk about through our series of subsequent workshops. And so as a collaborative group of university students and Caroline House students. We wrote letters to city officials, the mayor's office, the health department with this photographic evidence. And we did receive some callback from the anti-blight office following up on the addresses and some of the things that we were hoping to clean up. We talked about some of the environmental injustices, and we had a community cleanup day for Earth Day where the Fairfield students and the Caroline House students came together and we did mulching and cleaning and gardening, and it was really nice. Caroline House residents also wanted to go door to door to do a neighborhood advocacy campaign, and our students went along with those Caroline House students as well, asking neighbors to commit to change. And they had a Caroline House Cares campaign to sort of advocate for change from within and around their community. And then Caroline House actually presented their results to our students. And so it was really this nice bidirectional learning that we had going on here. Here are some of the things that my students worked on, some sample social media posts as we got up to Earth Day, scripts that we could use for both the parents and the teens that attended the center to call these various offices. And we also complemented it with some other workshop activities like the do's and don'ts of composting, and Caroline House created their own composting as a result. We did windowsill gardens with recycled materials. And so my students helped create some of these infographics and work on the workshops to sort of guide some of these conversations around environmental justice issues. We also wanted to center language justice in this work. The linguistic partnership was really important here. So when we did our Earth Day bingo and when we did priorities for Earth Day, we did them in a bilingual way. And while we started with just English and Spanish with translation and live interpretation, we've now also gone beyond that. We have translation and sometimes interpretation in Haitian Creole, Portuguese, Turkish, Swahili, Korean. It's really been a robust multilingual experience. And so there's a lot more collaborative work to do. The work has been ongoing since our original Photo Voice project in 2023. We realized that to really expand and have more of an impact beyond what we could do in one semester, we needed to involve some other community partners. And so Groundwork Bridgeport and Make the Road Connecticut have both been really valuable community partners that have come into our workshop series to talk about how to advance this work. Groundwork Bridgeport does a lot of environmental advocacy in the community, and Make the Road Connecticut does a lot of community building. So they've been wonderful partners to work with Caroline House and Fairfield youth students together. And now we're part of the East End Community Initiative, where we're trying to develop more cleanups and ongoing and sustainable mapping of some of these areas to clean up, to continue working on it collaboratively with the Fairfield students and Caroline House together. And so we really tried to build this partnership with trust and inclusion and very participatory focused. And so I like this idea of braided collaboration, which is beyond just exchanging ideas, that we really wanted to work on something in a collaborative fashion. And so this took some intentional work with the students to ensure they weren't bringing generalizations, bias, or assumptions to the community site, also to ensure continuity between semesters so the community didn't feel like every semester they were getting a new group of students. So the students wrote letters to future students at the end of every semester, and we gave them to students at the beginning of the next semester. We also incorporated modules on working with an interpreter so we could have that fluidity. We did debriefing after every visit, both in-person debriefing and then written debriefing that they did in discussion board format. And then we came back to the classroom and did some more collective debriefing with post-it exercises and fishbowl exercises and lots of different things to make sure we could really reflect and grow. And the summation of the student work was presented in a final portfolio, which included discussion posts of some of their growth, some of the products they created for the health workshops, and some of the lessons that they learned, how they're tying what we did in the readings, what we did in the didactic portion with what we're seeing in the community. I learned over time that it was important to develop an expectation rubric for the students. I wanted them to feel like, they could have these low stakes contributions to the course, but have a really high stakes final product so that the community felt like they were receiving something that was really polished and thoughtful. And so worked on how to really scaffold that for the students in a more intentional way. We didn't just focus on environmental justice. Other issues came up, so I won't highlight them all here, but we did, beach ball icebreakers in October. We did a breast cancer awareness discussion. We made keychains, and we also talked about where to get local mammographies. We did self-breast exams with rice and marbles and socks, and we really had a really robust dialogue there. The community keeps suggesting really great ideas, and we try to come through with different innovative strategies. The students get to flex their creative muscles. We do food demonstrations to talk about nutrition. We talk about mental health. We've done some emoji check-ins, making calm jars, meditations, mindfulness journaling, vaccination reminders, oral health, and more. And I think that the students really appreciate the opportunity to have this real world engagement practice, but it's also, as stewards who are going to go into the community, wanting to make sure that the students feel really prepared that what they learn in the classroom has to translate into the community. And it seems like this approach, while a little bit different than what some students may be used to, is something that they seem to respond really well to, and hopefully the growth and the learning continues. And so I just really want to thank Caroline House for allowing us to really collaborate with them so deeply. And also to all of my students who've participated in this work over the year and our language partners who have worked with us to make sure we have really high quality translations and interpretations. And finally, the Center for Social Impact, as well as our other partners. At Fairfield University, the Center for Social Impact really supports our ability to go into the community, the logistics, the vans, the funding of the interpreters. And so they've been a really valuable asset. So this is their motto, learning, research, and action. And here's my contact information. I welcome your questions after the second presentation. And so I'll end here and I'll just pass it over to my colleague Priscilla to tell us a little bit about her course. Thank you so much.
Oops. Thank you, Jennifer. Can you see my screen now? Let me try to present here. And I have to. Is it good? Wonderful. Thank you. Thank you so much for the opportunity to present our curriculum here. I really appreciate. Again, I'm Priscila Castanha. I'm an assistant professor in the University of Pittsburgh School of Public Health. And I'll be talking a little bit about our course. The formal name of the course is Public Health 0464, Infectious Disease Emergencies, Prevention, Preparedness, and Response. And this course was really designed to introduce students to the foundational knowledges and skills that are needed for you to address public health response to infectious disease emergencies and pandemics, all the way from learning from those pandemics, but also minimize their impact in the communities and well-being. We go full cycle with this course. We cover a variety of topics, all the way from pathogen transmission, climate environmental drivers of pathogen emergency, through the impacts of pandemics in vulnerable populations, risk communication, development of medical countermeasures, and also equitable distribution of these countermeasures. And this is an undergraduate course. It is also building on the foundational and the core courses that we have in our Bachelor's in Public Health program. So it is designed for sophomore plus, and it is offered every spring. Our curriculum is really focused on interactive, skill-based learning. So we combine both traditional lectures that are aimed at developing those foundational understanding of the core principles of infectious disease emergencies with several innovative teaching strategies. With our with our traditional lectures, we always try to have interactive segments, and this can be through pool, quizzes, discussion that we have, usually through the use of, facilitated by the use of technology like Top Hat that the students seems to like a lot, or other strategies like the think, pair, and share approach, sometimes with a rapid fire presentation in the end. I'm a viral immunologist by training, and I'm a nerd with science podcasts. And one of the podcasts that I like the most and follow religiously, it's called This Week in Virology. So inspired by that, I created what we call This Week in Infectious Disease Emergencies. So what we're doing there is a 5-minute snippet at the beginning of the class where I bring real world events, infectious disease emergencies that are happening. They're relevant and they are in the news. For example, last week we talked about the Nipah virus outbreak in India and how they detect that outbreak, how they are managing that outbreak, what kind of public health measures they are taking to avoid the spread and keep that outbreak contained. We talk about the rising measles cases in South Carolina. So we bring that to the class and we tie that to the concepts that we are working in the course. And it is a really, really good strategy to help boost the engagement of the students at the beginning of the class, because most of the time they have seen that on the news and they start talking and conversations are started. And most of the time, at the beginning of the semester, is initiated by me. But as the semester progresses, then the students start bringing their own news, and we start having those discussions in the beginning of every class. Um, we also have case studies. These are all based in real case scenarios. We have 3 case studies that are sprinkled throughout the semester, and that's an opportunity for the students to apply that theoretical knowledge to those real world scenarios. But what I'm going to be focused my presentation mostly today is in the experiential learning project and the tabletop exercise. So the experiential learning project comes into many flavors, and I'll give some examples of that. But the idea here is to really bridge that gap between your theoretical knowledge and practical application. And then the tabletop exercise is an exercise where students work in groups to create a pandemic preparedness and response plan. And this is done through hands-on simulation, role-playing, and also scenario-based learning. So I'll give you more details about that. So this is a fairly new course, actually. This is only my second year, so we started last year. So for the spring of 2025 cohort, the theme of our experiential learning project was infectious disease education in action, learning through service engagement. So for that project, we partnered with 4 different organizations: the Community Human Services, the Humane Animal Rescue of Pittsburgh, the Vaccination and Health Connection Hub, and the Schiller-Stein Academy. And each student was matched with one of those institutions based on area of interest. So if I had a student that was interested in food insecurity, housing security, emergency shelters, and how that relates to pandemics and infectious disease emergencies, they would be tied to the CHS. Or if they're interested in vaccination, pandemic response in hospital and university settings, then they would be tied to the hub. And that allocation was done in the beginning of the semester through an online survey. But the idea here again is really to allow the students to go to that full experiential learning circle. So you're experiencing, you're reflecting, you're thinking, and you're applying. So the way that the project was structured, they had a structured interview in which the students would practice their interview skills while learn about a specific topic. So we have students that interview the medical director of the hub, others that interview the project manager that was responsible for the food pantry and the emergency shelter for CHS, or the medical director of medical services or director of community programs for the Humane Animal Society. And they also have to do service learning so that the students would actually volunteer and participate in activities with that partner organization. We had, this is like a half semester long project. So when we reached that mark, we had an in-class debriefing. So the students would, each group would share their experiences and reflect on that and how that connects with the content that we are learning during the semester. And they also had a hands-on content creation. So that involves creating a social media post that was related to that experiential learning experience. Here's one example of the groups. Like this is the group that actually partnered with the Schiller-Stein Academy. And the students in this group, they worked with a 6th-grade teacher to develop a set of activities to be part as the Stein Academy Climate Change Week. So the focus of this group was develop activities that was related to how climate environmental change impact the emergency of pathogens. So they were very, very, very creative. They created interactive stations for the students. They had a slideshow and a Kahoot game. They had a TIC education station. So we managed to actually partner with a researcher here that worked with TICs. And then we took TICs in different stages of development. They did a little find the tick on a bagel game, and then they would talk about ticks and how ticks can carry diseases. They did an outbreak control game as well. It was very interactive and very rich material for this that they developed for that week. And they also interview a 6th grade math teacher. And there were several themes that they talk about during this interview, not only the challenge and the impacts of pandemics in education, but how they started using more technology, the positive and negative aspects of that. the impact of the pandemic on the mental health of both teachers and students, the decline in literacy rates. So it's very rich exchange between the students, our students, their students, and the teachers in the end. Here's one example of the social media content. So this was for the group that worked with the Community Human Service. They created Instagram carousel posts. And the idea here is they really want to highlight the food pantry that they have. So they each kind of like carousel would have a different information, and then in the end they would have a little QR code where you could like volunteer. So this was really a creative assignment that they can learn by doing and use those skills to foster creative and communication skills. And then the second half of the semester, we actually switch gears and then we do a group project. And this is based on fictional pandemic scenarios. And that includes a simulation exercise. And it culminates with the preparation of a national preparedness and response plan. So each group we work as a regional task force, and they are assigned a specific pandemic scenario in a specific country. And then they're going to work through the semester to develop that plan that is tailored to that country, to that public health emergency. We do that through dynamic simulation. So I provide in-class time for the students to work on that project. And every week I provide a real-time, what we call inject. So this is an evolving situation update. And then this always required the groups to critically analyze and adapt their plans to those evolving variables. And then in the end, we simulate a World Health Assembly. So the students will have to present their strategic framework and then defend their policies and their preparedness plan before a panel. And all of the outbreak scenarios and simulation exercises that we work in this class, they were adapted from the Pandemic Preparedness Learning module from the PRAT initiative, which is Preparedness and Emerging Threats Initiative, and they are kindly provided by the World Health Organization. So this is the material that they actually use to train the countries in pandemic preparedness. So it's very special for the students to know they're actually working with that kind of material. And what is next for our course? So as I mentioned, this is a new course. We're taking baby steps here. So the spring 2026 is ongoing. I try to make it as dynamic as possible. I also rely a lot on the feedback of the students. For example, for our experiential learning project for this year, I'm relying on that feedback. Last year, one of the feedback from the students was that they really liked the opportunity to have that one-on-one interview with the people that are involved in these institutions, in organizations, because they really get that perspective that you can't find in a book. So because of that, this year, the theme of our experiential learning project changed. So now we are doing leveraging oral history for innovative response to modern infectious disease emergencies. So they are right now doing a oral history project. So they are interviewing people, defining key elements, and then they are going to be identifying, after reflecting on that interview, a couple of themes or lessons learned from that person that they're interviewing. And this can be like a failure in communication, can be supply chain gaps, it can be personal resilience, and then they're going to create a specific actionable solution to the challenge that was identified by the in the interview. And the idea is to address that person's lived experience to improve future emergency responses. We are also, this is going to be to the next cohort, adding a book club as a creative assignment. And the idea here is to get the students to motivate them to read, increase student engagement. And the idea is to use those historical lessons and then learn from the past to fight future pandemics. So I want to make sure that I acknowledge our community partners and also our guest lecturers that bring the expertise that I don't have on some of the topics for the course. We work with these community partners with not only this course, but also other courses that I teach in the program. And also a special thanks for our director and our Ada Yoki and our experiential learning specialist, Adriana, which helps make sure that we stay in touch and always bringing more community partners to work with us. And for the Pandemic Preparedness Global Platforms from the WHO for providing that material that is so rich for us to use in class. So I also leave in my contact here, and I'll be happy to answer any questions.
Thank you so much to both of you. Those were wonderful. Just really excited to read your proposals, obviously, but really excited to hear it in action. So we're going to go ahead and take a few questions from the audience. So one question that I want to start with that I think would apply to a lot of folks is if another school or program or another faculty wanted to try to start something similar to your course, how would they get started? What's your advice to them? And we could have both of you answer if you don't mind. So,
Sure, Priscilla, go ahead. You go.
Yeah, I think like, I don't know, take a chance, go for it. I think it's hard when you start, but the students appreciate so much to have like dynamic courses like that and to have this contact with the community and work in partnership with community members. Try to work with your institution. Like here, I have our experiential learning specialist that put me in touch with all of these people. And then I created that connection a couple of years ago that I bring not only to this course, but also to other courses. So try to bring those resources as well.
Yeah, I mean, I echo what Priscilla said, and it seems like we both have a good, supportive, institution with offices that support this work. I also think just the relationship building, recognizing that that takes time. So, like, we had several years of really relationship building with the partner, making sure that it was going to be a mutually beneficial sort of partnership, that it was going to be sustainable beyond just one semester, 1 year, and thinking about how that looked in a forward-looking way and sort of investing in that upfront planning before we just hit the ground running with the students. And I will say this course is probably the most evolving and dynamic course that I do since it involves the community. And so being ready to sort of pivot and reassess and say, okay, we need to change this because there's all these new relevant contextual factors. And so just building in the time and also the support to make sure if you're going to engage with the community that you can do it in the best possible way for the community and the students.
Right. Okay. So, Jennifer, and this we'll direct this one to you is can you talk to me a little bit about or talk to us about how do you measure effectiveness? How do you teach your students to measure the effectiveness of what they're doing in the community context?
Yeah, so we do it from both sides. We measure the students' understanding of like the effectiveness of the community engagement piece, but we also want to know from the community what they feel like. We have an anonymous survey that goes out from the Center for Social Impact, both to our students and the community, and that's really interesting because it comes from almost a third neutral party where they can be responsive of what they're seeing, and then we can kind of compare them. Like if the students are having a really robust experience, but the partner not so much, then that's unbalanced or vice versa. And I also do my own surveys, both of the students in class. We have a community engaged learning associate that does it without me in the room, so it can really feel like they can be honest in addition to our normal, course evaluations. And then for the community partner, we deliver on our last workshop day a survey in multiple languages. So if participants feel more comfortable responding in their primary language, they can do that. And we ask for feedback about topics. We ask for feedback about what worked well and what didn't work well. And I think that our best feedback comes from those survey responses, and we use that to guide and shift and reimagine our next sort of semester. And we're constantly getting feedback from the stakeholders in the community as well. So like the executive director, she might say this landed or this didn't land, or be mindful of this. And so I think being very responsive to those and sort of being ready to take that constructive feedback is an important part of keeping it effective.
Great. Priscilla, we'll direct the next question to you, is whether or how much your community partners have influenced the curricula. And Jennifer just mentioned pivoting, and so it's another question for you also is, could you tell us whether you've ever had to pivot mid-semester based on real-time needs?
Yeah, I think the curriculum stays as dynamic as the field and as dynamic as the necessity of the community partners are. And I think it's always this like feedback loop that we are creating, right? So we are trying to address like the gaps of the institutions, and then at the same time we bring that into our curriculum. I didn't have to pivot mid-semester because that was my first run with that course. I did pivot from one semester to the other. And there are topics that we actually touched during this course with our previous cohort that now we are transforming to a capstone for another course. For this course in particular, I try to keep the topic in within the infectious disease emergencies and pandemics realms. But sometimes topics will emerge that we can, take into another direction. It's just not like the right fit for this course. So then we work with another course. But it's always evolving, and it's very dynamic. And I think that's the beauty of it, to be honest.
Yeah, it's like life.
Yeah, exactly.
Yep. All right, so we'll do one more question. I'm going to throw this one at both of you, but if you could share with us, pie in the sky, if you could have anything happen with this course, what would it look like in the future?
That's a tough one. But I think like as we continue to build our partnerships, it would be really, really great if we have the ability to kind of expand beyond what we can envision in a semester to create something that really, if we're doing this community building and we're doing this advocacy and we're coming up with these priority public health issues, how can we bring them to greater attention, right? How can we go beyond what we're just learning in our local sphere to make policy directed change, to advocate for, broader scale things. And so that requires boots on the ground, funding, resources,
Yeah.
support. And some of those things are in place, but sometimes given the funding of community partners and grants and things like that, it's not as stable as I think we would like to see it. And so if there's ways that we can come in as an institution and as a community partner and say, okay, what are the gaps? How can we fill them? How can we leverage this collective capacity to do more when we know there's a lot that needs to be done in the public health landscape right now? I think that would be ideal. And that's something that I think we're always trying to achieve, but is not always like so immediately transparent, semester to semester.
Yeah, I think it's in the same lines as Jennifer. We wanna those community partners to be long-term like educators with us in this course, right? So really building those projects and seeing like a cumulative benefit for the community partners and for the students and for the society as a whole is kind of my long-term goal for this course. But it takes a lot of work. It takes patience, support, right, funding, and this are stuff that we are trying to work around and then make sure that we keep the eyes on the future and keep moving forward.
Yeah. Okay. All right. Well, I think that wraps it up for today. But again, thank you to both the presenters. This was absolutely fantastic. We will be posting today's presentation, the recording on our website. So we invite folks to come back and share the link as soon as it's available. And I hope you all will join us on our next presentation on March 4th. So with that, I want to say thank you again to the presenters. All right.
Thank you so
Thank
much for
Thanks to
the
you.
everybody.
opportunity.
Bye-bye.
Bye.